Okay, can you explain and share with us the prescription drugs that are being administered to COVID positive patients who are hospitalized?
Yeah, so there are not that many that are out there. I think everybody is familiar with hydroxychloroquine. That is a drug that was used to treat malaria, I think rheumatoid arthritis, lupus. It's something that's existed for decades, 60, 70 years. There are people that take that drug all the time for those different conditions I described. When it was first shown as promising for helping relieve the symptoms of patients that were really sick and that were intubated, for some, hydroxychloroquine, really accelerated their recovery. We've heard some pretty remarkable miracle stories that have been experienced by folks that weren't expected to survive. And initially, they were asking us to use hydroxychloroquine along with zithromycin, a very common antibiotic, a Z-Pak, we're all used to. So they were using those in combination, but then started observing a growing mortality rate for patients that were given that combination. So the CDC, the FDA, pretty much took the zithromycin out of the picture. So we still administer hydroxychloroquine to patients, not just in the ICU, but also those that are in 2 South. The most promising everybody's been listening to is remdesivir. So remdesivir is an antiviral. It's been developed it may have been developed as part of combating SARS-CoV-1. Where COVID-19, the technical name for it is SARS-CoV-2. So SARS-CoV-1 was a virus that many folks might remember a number of years ago. It kind of came and went, and also Ebola is another condition or virus that the remdesivir has shown effective. So remdesivir has been what's an experimental drug, not available to hospitals up until now. But the FDA and the government granted it emergency use classification just recently. So we did receive last week roughly 15 vials of remdesivir, which is about enough to treat 2 patients. But today we received 180 vials, which is enough to treat maybe 15 to 18 patients. We actually have already given remdesivir to 2 of our patients. The first patient, unfortunately, did not survive, was just too far along in the disease and probably was just given too late. I think we're hearing that remdesivir given more early on in the disease development might be more promising. So that will be a drug that we will be administering. And what we've seen in that drug is it can, again, accelerate the recovery. It can reduce the amount of time that somebody spends on a ventilator, which is really an important part of recovery. The longer you spend on a ventilator, the more difficult it is to fully recover. So remdesivir is showing a great deal of promise. We also have been administering antibody plasma. So you've probably heard about that again, patients that had the COVID virus, fully recovered, now have the antibodies in their immune system, and they donate their plasma, which is now rich in those antibodies, and we inject them into those COVID positive patients, again, generally those that are in critical care. I don't know offhand what the experience has been, but we have used it relatively extensively. And then, fever reducers, ibuprofen, Tylenol, IV fluids. A lot of patients are severely dehydrated, and then those, managing pain are the primary medications we use.
Okay, thank you.